Welcome back to EM Spanish. Today's lesson will be covering abdominal pain. I'm your host, Professor Sancho. Before we begin, a few quick disclaimers. The horrible and racy opinions in these podcasts are mine and mine alone, and not to be associated with any medical school, residency program, or future employer that I may have. Additionally, these should not discourage or replace the use of licensed interpreters in caring for your patients. And although you may trust me, I cannot make any warranties for any errors or consequences from the applications of these lessons. So, for today's lesson, we'll briefly go over some relevant abdominal anatomy, cover some useful phrases for getting the history of present illness, go over past medical history and different medications that people might take to deal with abdominal pain. Additionally, we'll go over some phrases you can use during your physical exam, and then go over plans and parting words for your patients, such as diagnostic studies and instructions, such as informing them that you're going to need a blood or urine sample, or to tell them that they can't eat or drink anything. So, to begin, for the abdomen, el abdomen, abdomen, el abdomen. For back, la espalda, back, la espalda. Arm, el brazo, arm, el brazo. Chest, el pecho, chest, el pecho. Hip, la cadera, hip, la cadera. Buttocks, las nalgas, buttocks, las nalgas. Spine, la espina, spine, la espina. Stomach, el estómago, stomach, el estómago. Small intestine, el intestino delgado, small intestine, el intestino delgado. Large intestine, el intestino grueso, large intestine, el intestino grueso. Appendix, el apéndice, appendix, el apéndice. Colon, el colon, colon, el colon. Anus, el ano, anus, el ano. Keeping in mind that el año refers to year, whereas the ANO spelled without a tilde over the N is pronounced ano. Gallbladder, la vesícula biliar, gallbladder, la vesícula biliar. Gallstone, el cálculo biliar, gallstone, el cálculo biliar. Pancreas, el páncreas, pancreas, el páncreas. Liver, el hígado, liver, el hígado. Keeping in mind that the H for this word is pronounced silent. Stool, el excremento, stool, el excremento. Alternatively, one can refer to caca, which is a more informal term that may be understood better by children. So, poop is caca. Poop, caca. Hernia, la hernia. Hernia, la hernia. Ulcer, la úlcera. Ulcer, la úlcera. Polyp. El pólipo. Polyp. El pólipo. And now to the HPI. So, again, we'll have a lesson that's going over the HPI and review of systems separately, and we're going to repeat a lot of these phrases between different lessons. However, the goal will be for you to get incredibly comfortable with these very common and very useful phrases. So, when did this begin? ¿Cuándo empezó? When did this begin? ¿Cuándo empezó? Pain, el dolor. Pain, el dolor. A little, un poco. A little, un poco. Moderate, moderado. Moderate, moderado. A lot, mucho. A lot, mucho. Tequila. Strong, fuerte. Strong, fuerte. Has the pain migrated? ¿Ha emigrado el dolor? Has the pain migrated? ¿Ha emigrado el dolor? Does the pain radiate anywhere? El dolor irradia a cualquier parte. Does the pain radiate anywhere? El dolor irradia a cualquier parte. How did the pain begin? ¿Cómo empezó el dolor? How did the pain begin? ¿Cómo empezó el dolor? Show me where. Enséñame dónde. Show me where. Enséñame dónde. Keep in mind that this command is conjugated in the formal usted form. Do you feel bloated? ¿Se siente hinchado? Do you feel bloated? ¿Se siente hinchado? Then, what were you doing when the pain began? ¿Qué hacía usted cuando empezó el dolor? What were you doing when the pain began? ¿Qué hacía usted cuando empezó el dolor? Describe the pain. Describa el dolor. Describe the pain. Describa el dolor. Sharp. Agudo. Sharp. Agudo. Stabbing. Punzante. Stabbing. Punzante. Dull. Sordo. Dull. Sordo. Pulsating. Pulsativo. Pulsating. Pulsativo. Crushing. Aplastante. Crushing. Aplastante. Aching. Doloroso. Aching. Doloroso. Deep. Profundo. Deep. Profundo. Pressure. La presión. Pressure. La presión. Tightness. La tensión. Tightness. La tensión. Menstrual pain. Dolor menstrual. Menstrual pain. Dolor menstrual. On a scale of 1 to 10. Sobre una escala de 1 a 10. On a scale of 1 to 10. Sobre una escala de 1 a 10. Have you had this before? ¿Lo ha tenido antes? Have you had this before? ¿Lo ha tenido antes? Anything make it better? ¿Algo lo hace mejor? Anything make it better? Algo lo hace mejor. Anything make it worse? Algo lo hace peor. Anything make it worse. algo lo hace peor. After eating. Después de comer. After eating. Después de comer. After moving bowels. Después de defecar. After moving bowels. Después de defecar. Now we'll go on into review of systems. So, we'll begin with the GI review of systems. Appetite. Apetito. Appetite. Apetito. More or less. Más o menos. More or less. Más o menos. Hunger. El hambre. Hunger. El hambre. Keeping in mind not to say hombre, which is man in Spanish. So, hunger. El hambre. Weight gain. Subido de peso. Weight gain. Subido de peso. Weight loss. Bajado de peso. Weight loss. Bajado de peso. Nausea. La náusea. Nausea. La náusea. Vomited. Vomitado. Vomited. Vomitado. How many times? ¿Cuántas veces? How many times? ¿Cuántas veces? Blood. La sangre. Blood. La sangre. Diarrhea. La diarrea. The universal word diarrhea. La diarrea. With mucus. Con mucosidad. With mucus. Con mucosidad. Dark. Oscuro. Dark. Oscuro. Constipation. El estreñimiento. Constipation. El estreñimiento. Black specks. Los granos negros. Black specks. Los granos negros. Are you tolerating liquids? ¿Está tolerando líquidos? Are you tolerating food? ¿Está tolerando comida? Have you had gas from below? ¿Ha tenido gas de abajo? Have you had gas from below? ¿Ha tenido gas de abajo? Last bowel movement. Última evacuación. Last bowel movement. Última evacuación. Now, we'll be covering female abdominal pain and GU symptoms in greater detail in another lecture, but briefly, some questions you can ask. Pain with urination. Dolor al orinar. Pain with urination. Dolor al orinar. Blood in urine. Sangre en la orina. Blood in urine. Sangre en la orina. Pregnancy. El embarazo. Pregnancy. El embarazo. Period. La regla. Period, but in the woman sense. La regla. Sexually transmitted infections. Enfermedad de transmisión sexual. Sexually transmitted infection. Enfermedad de transmisión sexual. Briefly, a few questions that may be relevant to any chest pain that could radiate to the upper abdominal area. To ask about a cough. La tos. La cough. La tos. Shortness of breath. La falta de aire. shortness of breath, la falta de aire. Chest pain, dolor de pecho. Chest pain, dolor de pecho. Palpitations, palpitaciones. Palpitations, palpitaciones. Moving on to useful exam phrases for when you're going to do your physical. Remove your shirt, please. Quítese la camisa, por favor. Remove your shirt, please. Quítese la camisa, por favor. Breathe deep. Respire profundo. Breathe deep. Respire profundo. Touch the spot. Tóquese el lugar. Touch the spot. Tóquese el lugar. Where does it hurt the most? ¿Dónde le duele más? Where does it hurt the most? ¿Dónde le duele más? Does it hurt anywhere else? ¿Le duele en algún otro lugar? Does it hurt anywhere else? ¿Le duele en algún otro lugar? Does it hurt more? ¿Le duele más? Does it hurt more? ¿Le duele más? Does it hurt less? ¿Le duele menos? Does it hurt less? ¿Le duele menos? Does it hurt when I press here? ¿Le duele cuando le aprieto aquí? Does it hurt when I press here? ¿Le duele cuando le aprieto aquí? To tell them about the need for a rectal exam. Rectal exam. Tacto rectal. You may also tell them that you're looking for blood or la sangre. So rectal exam. Tacto rectal. So when you're dealing with a patient and want to assess for rebound tenderness, when I release. Cuando suelto. When I release. Cuando suelto. So when you're letting go. This is a useful phrase for rebound tenderness. And you can ask them about their dolor and whether they have más or menos. So, going over some useful past history. Abdominal surgery. La cirugía abdominal. Abdominal surgery. La cirugía abdominal. Scar. La cicatriz. Scar. Cicatriz. So if you have a patient that has a visible scar but denies any past surgery, you can ask them about their scar. Hypertension. La hipertensión. Hypertension. La hipertensión. An alternative way is to say la presión alta for high pressure. For atrial fibrillation, la fibrilación auricular. Atrial fibrillation. La fibrilación auricular. Bowel obstruction. Obstrucción intestinal. Bowel obstruction. Obstrucción intestinal. Cirrhosis. La cirrosis. Cirrhosis. La cirrosis. Ascites. La ascites. Ascites. La ascites. To explain GERD or acid reflux, reflujo ácido. Acid reflux. Reflujo ácido. Gastritis. La gastritis. Gastritis. La gastritis. Irritable bowel syndrome. El síndrome del intestino irritable. Irritable bowel syndrome. El síndrome del intestino irritable. Celiac disease. La enfermedad celíaca. celiac disease, la enfermedad celíaca. Crohn's disease, la enfermedad de Crohn. Crohn's disease, la enfermedad de Crohn. Keeping in mind that there's no such thing as the apostrophe S in Spanish, so they say of someone. In this example, the disease of Crohn. Moving on, ulcerative colitis, la colitis ulcerosa. Ulcerative colitis, la colitis ulcerosa. And more, just testing out that Spanish accent. Diverticulosis, la diverticulosis. Diverticulosis, la diverticulosis. Pancreatitis, la pancreatitis. Pancreatitis, la pancreatitis. Cholecystitis, la cholecystitis. Cholecystitis, la cholecystitis. Biliary colic, el cólico biliar. Biliary colic, el cólico biliar. Proving once again that if you just put an accent onto all your English vocabulary, you might get through to your patients. So to go over possible things that they could have ingested to either help or harm themselves: antibiotics, los antibióticos. Antibiotics, los antibióticos. Antacid, los antiácidos. Antacid, los antiácidos. Laxative, el laxante. Laxative, el laxante. Corticosteroids, los corticosteroides. Corticosteroids, los corticosteroides. And NSAIDs in Spanish are spelled AINES, or for anti-inflamatorios no esteroides. So AINES for NSAIDs, which stands for anti-inflamatorios no esteroides, such as ibuprofen or ibuprofeno. So to ask a patient about contrast for an exam they may be receiving: agente de contraste. Contrast, agente de contraste. For alcohol, el alcohol. Alcohol, el alcohol. So to ask a patient if they take more than 2 alcoholic drinks daily: ¿Toma usted más de 2 bebidas alcohólicas al día? Do you take more than 2 alcoholic drinks daily? ¿Toma usted más de 2 bebidas alcohólicas al día? Now, for certain parting words that you can say to tell a patient they should not drink or eat anything: no deba comer ni beber. You should not eat or drink anything. No deba comer ni beber. We need a blood sample. Necesitamos una muestra de sangre. We need a blood sample. Necesitamos una muestra de sangre. To ask for a urine sample and help speed up patient care: we need a urine sample. Necesitamos una muestra de orina. We need a urine sample. Necesitamos una muestra de orina. To tell them about possible diagnostic tests you may be ordering: for X-ray, los rayos X. X-ray, los rayos X. The way I remember that the letter X in Spanish is pronounced as X is to remember the fantastic beer Dos X. And additionally, because there's the letter dos in Dos Equis, you should remember that the word for rays in Spanish is plural. So instead of el rayo, it's los rayos, for los rayos X. For ultrasound, El ultrasonido. Ultrasound. El ultrasonido. For a pregnancy test. La prueba de embarazo. Pregnancy test. La prueba de embarazo. For a CT scan or computed tomography. Tomografía axial computerizada. Computed tomography. Tomografía axial computerizada. Alternatively, a better understood way to say this would be el escaneo, for just simply the scan. So, el escaneo, scan. And that concludes our lesson on abdominal pain. So again, if you have any concerns, questions, feedback on the format, or perhaps some lessons that you'd like to see in the future, please send me an email or leave a note in the comments section. And before we go, a way that you can practice your Spanish on the outside is by renting a movie. So there's a fantastic film that was released, I believe, in the year 2009 called REC, and it's a horror movie. Has a lot of vocabulary on pre-hospital medicine. They visit a firefighter's house. Additionally, this is a zombie film, so there's plenty of vocabulary on infectious disease, and you don't need to have a firm grasp on the Spanish language to get a kick out of the thrills and screaming that's happened. So thank you all for tuning in. I love you all, just not equally or in that way. So I hope to see you next time on the next episode of EM Spanish.